What you're about to see is a dramatisation showing a typical patient experience today and how things will be different in the NHS of the near future. In an ideal world, information about our health will be available everywhere at all times.
But I want it now.
Is it your birthday now?
You're me.
Talk like that, Sally.
But it's not an ideal world. Currently, when staff see patients in an emergency, they can only diagnose what they see before them and what they can glean there and then.
OK, I'll check. OK. Right, she's very breathless, she's been sweating, and I think she's having a heart attack.
They should be able to access a patient's care record whenever and wherever they need to.
Are you in pain?
In some cases, this could save lives.
Oxygen defib. What do you need to do? Has your granny had this sort of problem before, Sally?
Yes.
And Maggie Green, is that your granny's name?
Yes, I have a Granny Green and I have a Granny Black.
OK, Maggie Green, Redwoods, born 29th of December 1935. Is that you? Right. She's got no cardiac history but COPD. Carbon dioxide retainer, max 4 litres of oxygen. Have you ever ridden in an ambulance before, Sally?
The NHS is developing electronic information services. Their applications are wide-ranging, and their benefits will be felt right across healthcare.
This is Maggie Green. She's about 70. She was found collapsed outside the Riverside Shopping Centre. Suspected MI, symptoms heart failure, pulse 172, blood pressure 172 over 96, and a respiratory rate of 34 on 100%.
Her pulse was 172.
Did I say that? Oh, 112, my mistake.
Just go over those details again for me, please.
Yeah, Maggie Green.
The NHS Care Record Service and supporting technology has been designed to provide better, safer care.
Hi, Danny.
Hello.
Yes, this is Maggie Green, 72. She collapsed outside Riverside Shopping Centre.
Pulse 112, blood pressure 172 over 96. Respiratory rate initially 34, dropping to 25 5 minutes ago. And you've given her oxygen at 4 litres per minute. And you are A139, aren't you, Bob?
That's us. Booking us in.
OK, done.
Records uploaded.
Done.
Right, see ya. Bye, Sally.
Now, Sally,
Capturing information electronically means that relevant information can be delivered immediately and in a standard format.
Control, A139 ready.
And it will also save you time.
I've just rang X-ray. They said, have you put the request on yet?
Yeah, absolutely.
The NHS Care Record will be made up of several parts.
Mrs. Green, how are you feeling?
Where am I?
You're in Central Hospital. Listen, I'm sorry, I need to ask you a few questions.
Central Hospital? That means I'm going to have to go through it all again. I've got COPD.
The summary care record will hold essential health history and current information, which will save time for both patient and doctor.
You're in Central Hospital.
Central Hospital? Does that mean I'm going to have to go through it all over again?
No, don't worry. Since you've already indicated that you don't mind, I've had a look at your summary care record. And now I can see that you have COPD. And I've made a few changes to your medication, OK?
Important history wasn't always available in the past because we use paper records and X-ray files.
I think we're going to have to run some tests, Mrs. Green.
Local care records will allow sharing of clinical information between authorised healthcare staff in different organisations.
I'll speak to the admitting team, but I think you're going to need to see a chest specialist.
Please, listen to me.
The system for storing X-ray images electronically, PACS, is part of this.
Your X-rays are on the system now.
Ah, great. Thank you. I'll just check something. OK, well, look, I can see that you've had an X-ray about a year ago, and when I compare the two, there's no deterioration, which is good. So at least this has been investigated before then.
Yes. They always say the X-rays look worse than they are.
Yes.
Manual appointment systems make care difficult to coordinate.
Now, Mrs. Green, are you seeing anyone about this unusual-looking chest X-ray?
I saw someone at St Andrews. I think I'm seeing him again in about 6 months or so.
Great. Do you remember who it was?
And I'm sorry, I saw several people.
OK, well, look, don't worry. What I'll do is, I'll write a note to the hospital. And if I put chest clinic, I'm sure it'll find its way to the right place.
So I just wait and see?
Yeah, it'll probably be about 3 to 4 weeks. But in the meantime, I need to make sure that you take your medicine.
The summary care record can contain a patient's care plan, as well as appointments and reminders for future appointments and treatments.
I can see that you've got an appointment in October with Dr. Patel. Now, I think it would be sensible if you saw him a little earlier, given what's going on. I'll make a recommendation.
Do I need a note from a GP?
No need for that. This episode will go in your care plan, and then I'll send a secure email to your GP, and she, can attach a note to your summary, and you'll be able to see it on HealthSpace.
Hey presto.
Are you comfortable with your new medication?
Well, yes. It's 4 puffs a day on the purple one.
Previously, if patients were confused about medications, it could take time to sort out.
I'm supposed to start reducing the dose at some point as well. I don't want to drag you all the way back out here.
Well, you should really get it sorted today. Why don't we look on HealthSpace?
Good idea.
Patients can choose to have access to their summary care record on HealthSpace. This provides them with the tools to look after their own health at the click of a mouse.
Bingo. 4 puffs a day on the Serotype Acuhela and reducing the pills from Monday.
There you go, and then you can see at the bottom you've got an appointment with Dr. Patel next Friday.
Wow. Better start pressing my party frock after all.
This all works both for the healthcare staff and for the patient in providing detailed, safe care records that are accessible where and when they're needed. All this is a key element in the future of the NHS. One day, not too far away, you'll wonder how you live without it. Right information, right time, right place.
Mrs. Green, it's really very simple.
Cut! Is there a problem?
Well, I'm sorry, I think there is.
Do you know what? I think it might be quite offensive to hard-working ambulance crews.
Records uploaded?
Done. Sorry, Edward, I don't know what I'm doing.
Cut! Well done. Very powerful.
I've just got a couple more questions on this HealthSpace business.
Again, with a question.
Edward, tell me again why I'm colouring.